Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. The nation's capital is set to increase testing capacity with new PCR testing center in the State House Clinic. Federal and state governments express concern over non-compliance to COVID-19 safety protocols as Wuse Market in Abuja is shut down. And published late-stage trial results show Russia's Sputnik V coronavirus vaccine gives 92% protection. We begin from the results. The 1st of February, the Nigeria Center for Disease Control reported 676 new confirmed cases and 21 deaths. However, 776 community recoveries were reported in Lagos and 96 community recoveries in Plateau State. Till date, the country has recorded over 131,000 cases of the SARS-CoV-2 virus, which includes the new variants as well, believed to be deadlier. Only yesterday, the NCDC had confirmed 6 new cases of the B.1.1.7 strain of COVID-19 in the country. The new cases are reported from the following states, 18 of them, plus the Federal Capital Territory, which include Lagos, that recorded the highest cases at 227, followed by Rivers 73, Niger 69, Plateau 56. The FCT recorded 50 cases. Other states like Kano recorded 44 cases, Oyo 43, and the list is on with Ogun, Gombe, and the other states recording cases as well. This is also coming on a day such as the lowest numbers is recorded in a single day as the PTF is calling for all to take the non-pharmaceutical protocols more seriously while the vaccine rollout in the country is yet to commence. The chairman of the Presidential Task Force on COVID-19 and Secretary General of the Federation, Mr. Boss Mustafa, is promising to establish a COVID-19 PCR testing center at the recently launched State House Clinic Special Care Center. Launching the center in Abuja, Mr. Mustafa stated that the weekly testing of the State House staff would be more convenient and confidential if a PCR center is set up at the State House Clinic.
I can give you my word that we will put a laboratory for the testing or a PCR facility in this facility, because this is supposed to be our priority. Very soon, you cannot travel the globe if you are not vaccinated. And we are not new to it. Years ago, you couldn't go into Europe, particularly UK, if you do not produce your yellow card.
Still speaking on vaccines, the Chief of Staff to the President, Mr. Ibrahim Gambari, draws from his experience while restating the need for all Nigerians to embrace the vaccine as a sure way to protect themselves and those more vulnerable to the COVID-19 virus.
For me, who sees the President so many times in a day, I have to protect myself in order to ensure that I protect the President. And if protecting myself means that I have to give up going to the town of my birth, so be it, because this is the importance that we must all attach to this. Yes, there were in the past some experiences in the northern parts of Nigeria, particularly in terms of vaccination, and also even conspiracy theory then, and online, all kinds of issues raised online. But the reality is that we have to embrace vaccine.
Now, following the directive to enforce the COVID Health Protection Regulations 2021, the FCT COVID-19 enforcement team have swung into action, shutting down some markets, including UTC Area 10 Market and the Wuse Market. Spokesperson of the task force, Mr. Atai Karo, says the market in question violated the COVID-19 protocols. He also stated that the team will be meeting with the market union leaders.
The task force were here yesterday and they made some arrests around here. though we know that most of them are not from the market, but they made some arrests that we are not disputing. And they took them to mobile court yesterday. And which from there, they have to, the court have to give the order to seal the market for non-compliance of the COVID-19 protocol. But as you can see now, we're on top of the gear. We are trying to put most things in order so that we'll fall back to what it used to be before. Not that we are not complying, but it's just because there's a little bit, there's a little bit less from us. So that is why it's like this. But now we are buckling up. We are trying to put things in order.
And from the nation's capital to Kaduna State, where the government has expressed concerns over the reported emergence of a fast-spreading coronavirus strain in the state. In an exclusive interview with Channels Television, the Kaduna State Deputy Governor, Dr. Hadiza Balarabe, says a definite report will come out in a couple of weeks on the extent of the spread. However, that extensive testing is already underway to identify the genetic evidence of the new strain. She also points out that the spike in the COVID-19 infection in the state has once again put a spotlight on the role of human behavior and individual responsibility in the containment of the pandemic.
Well, there's a new strain which spreads faster than what we used to have before. It's been reported here, but we're still watching because we have not done the typing in here in Kaduna. But it has been reported in Nigeria. We have not done the typing, so we can't really say until you do a kind of genetic typing of the virus, you won't know which is which. But with what we're seeing, the transmissibility of the virus now is really, on the increase. We're having many people coming out. So we're thinking maybe not. But NCDC has been very upright and out and about, trying as much as possible to provide information to all states on what is happening, and even with the newest strain. So we're still looking out, and we pray and hope that it's just our behavior rather than the new strain, and that God in His mercies will help us to make up our minds to keep ourselves safe. This new strain, apart from the fact that it has very high transmissibility, it's also, the fatality is also about 30 to 40 times more than what we had before. So I think people should know that, and people should be really very careful about, observing these laid-down protocols.
And still talking about human behavior, residents of Port Harcourt, the River State capital, are struggling to comply with the protocols. Some of the residents gave their reasons for not observing the basic COVID-19 guidelines, which they say are hinged on some beliefs about the weather condition and how government activities like the registration exercise for the national identification number in River State encourage the absolute flouting of the non-pharmaceutical regulations. Take a look.
As Nigeria plans to get some doses of the COVID-19 vaccines as soon as possible, non-pharmaceutical guidelines such as hand washing, physical distancing and the wearing of face masks remain a viable way to curb the spread of the deadly coronavirus. While the success of the non-pharmaceutical interventions in curbing further spread of the virus depends largely on the level of compliance by citizens and/or enforcement by the authorities, some residents in River State continue to ignore these safety measures.
Some persons are finding it difficult because they are saying that there is no COVID-19. There's nothing like COVID-19. But we are telling them that there is COVID-19. If you watch in net, you will see people outside the country where they are suffering about it.
Some of them are seen on the street without masks or wearing it inappropriately. Of equal concern is a congregation of enrollees for National Identity Number across the country. For instance, at the National Identity Management Commission head office in Port Harcourt, prospective enrollees are clustered and in most cases disregarding the COVID-19 protocols.
This is why we are doubting whether the coronavirus is real. If you watch people here, If the coronavirus is real, everybody here is infected. Even myself, I'll be infected. So I don't know what we are seeing in this government.
Nonetheless, citizens have been advised to take responsibility for their health, even as the world grapples with a second wave of COVID-19.
One of the key challenges is the fact that, in this second wave, some of the patients are actually coming without the classical symptoms, that we used to have. Okay, someone might just stroll into the hospital for one or other reason, but sometimes because of a high index of suspicion, the doctors might say, okay, let's go and do a test for COVID-19. And then we just discover that this individual is positive for COVID-19.
With over 5,000 confirmed cases and 81 deaths since March 2020, Rivers State ranks as one of the top 6 high-risk states with the pandemic. A call for all hands to be on deck to mitigate the impact of the second wave of the virus.
Professor Titi Obilade is a public health expert, and she joins us on the program from our Abuja studios. Thank you for joining us.
Thank you for having me. Listen, how are you?
Let's begin with the measures, all right, to stay safe. I mean, the COVID-19 non-pharmaceutical protocols. How do you feel seeing the same challenges we faced during the first wave, the non-challenge, the disbelief, and other poor attitudes to the virus, surfacing again this second wave? And we're seeing this evidence in activities of some Nigerians and also some government representatives.
Yeah, a lot of things, thanks for having me. A lot of things happen with human behavior. One of the things that is most difficult to control is human behavior, because you're talking about adults. They've been adults for 20 years, 30 years, 40 years. And so to all of a sudden tell them to change their behavior, they have to be convinced. They have to believe what you're telling them. And so what happens is that for them to believe, some of them have the base of the news they listen to, social media, because they have a distrust of the government. And so they listen and pick up their news item from the social media. And the social media they listen to is selective. And that's why you have some conspiracy theories where they'll say, oh, it actually doesn't exist. It doesn't affect the black man. And all those things will compound the behavior of a person that believes in those conspiracy theories. So what we can do, get to the base of that conspiracy theory. In other words, okay, if it's a social media they're using to pass on the false information, what the government can do is to get their own social media that as soon as the false information comes, maybe it disseminates exponentially to 15,000 people at, say, 6 a.m. And then by 6:30 a.m., let the government have like 100,000 news out debunking that news item. Because, once they get the followers on the news feed, it spreads exponentially. So there must be a dedicated number of workers that will debunk scientifically and evidence-based every iota of information that is fake news, every iota of information that is a conspiracy theory. Otherwise, it's going to grow. The conspiracy grows, it gels together, and it becomes something that we're not able to control. And if I do not believe in the conspiracy theory and I'm able to follow all the non-pharmaceutical protocols, but the next person that believes in the conspiracy theory will affect that person that does not. So what we need to do, try and convince the people that do not believe, scientifically, evidentially, that these things do exist, and try to debunk all their beliefs. Find out, why is it you don't? Is it because you are a black person, you think the sun will not allow you to get it? Explain to them that, well, the good thing about the sun, it gives us vitamin D, which we know scientifically can inhibit the replication of the virus, but that is not enough in itself for you to say you will not wear a mask. Explain to them that wearing of mask does not prevent the disease 100%. However, it reduces the viral load. And then you look at all these things that they're doing. They say they cannot breathe. You can show them a documentary of people who are actually sick, Look at how much oxygen tanks that they are consuming. Let people, in high places that have recovered and people in low places that have recovered, let them come and talk to them through the radio, through mainstream media, and then they'll actually see that, oh, can this be true? And then they'll begin to believe. And
essentially, Professor Obilade,
transparent.
Sorry to cut in, but these were also some of the measures that we saw during the first wave, but still about increase in messaging. The government has been doing several things, and we'll tell you about that, but we need to go on this short break. We still have more with Professor Obilade on the COVID-19 update program. Stay with us. Welcome back to the program, and we've been talking to a public health expert, Professor Titi Obilade. Thank you for your patience. So, talking about messaging and putting out the right messaging there for people to trust government. The government has adopted several messaging since the beginning of 2021. For example, the federal government putting out stiffer penalties in case you break a law, the non-pharmaceutical protocol, 6 months in prison or fine. We have states like Imo State saying 20,000 naira or fine, and states like Bauchi and several others have none. Some have 5,000. So essentially, these are some of the new regulations. Do you see them enforcing compliance?
Thanks for this question. The thing is this, dealing with human beings as somebody who wants to tell them what to do, remember, you're dealing with adults who have been doing things their own way for a long time. So in addition to trying to enforce it, you've got to be transparent with them. There are some messages that they feel are contradictory. I think one of the people you interviewed before I came on talked about the registration, linking up the national identification number is one example. Like we have probably 207 subscribers, and to link them up at this time. So, and of course, there's a deadline that has been extended. And so people that are involved, when they go to try and register their numbers, they find out that, can this be true? This messaging is contradictory to a COVID-19 protocol, because there are instances when they're unmasked, there's crowding. It's all a feast for the COVID. That, the COVID looks at it and like, oh yeah, this is meal for him or her. So it's if you have a messaging, and you have to be consistent in your messaging. And then you have to issue of transparency. There was a time we had this about Chinese doctors when they came in. Some of those things, people looked at it and they were like, what's this? It's contradictory to the messaging. So we have to be consistent. So I've talked about being consistent in your messaging. I've talked about being transparent in the governance and enforcing. Now, when you also want to enforce, you have to give a meaningful enforcement. When I say meaningful enforcement, if you ask somebody to pay 20,000, the person doesn't even make 20,000 in a month. It's not meaningful. So when we're talking about enforcement, we can enforce through learning. In other words, let it be a learning experience. Okay, maybe the person will go 80 hours, of a lesson plan on causes of COVID, how it can be prevented. Those are learning experiences. And then maybe they will ask them, watch this documentary, people who are using oxygen tanks, and see how much they consume. So if the punishment is not in tandem with the offense, what you will find out is that people will get fatigued, and then they will rebel. We have some countries like in France, the students just said, look, we're no longer doing lockdown. We want out. So there's just a little bit much more that you can keep people and enforce them. You've got to carry them along. And to carry them along, you've got...
I was going to ask, how much do you expect that this messaging will... How much do you expect that the messaging will also go into the vaccinations as soon as they come? Because there are a number of people that have their doubts.
Oh, yes. That's a great question, because you have to do the sensitization. I wrote an article, I think like 2-3 weeks ago, in one of the papers. And the idea then, what I spoke about is there must be sensitization. If you have not yet sensitized the people, again, you're dealing with adults, okay? Adults who have been doing their own things their own way, since they became adults. And all of a sudden, you are making decisions for them without consulting them. They have to be participatory in that decision making. And for them to be participatory in that decision making, you've got to carry them along. To carry them along, you have got to sensitize them. Sensitizing them means targeting the populations. Usually when you're going to target the populations, you go to the grassroots, and then from there you go upwards. If it's going to be at the local government level, at the primary healthcare centers, but you do not make decisions in absentia, because if you have not sensitized them and they believe in these conspiracy theories, what happens to the vaccines? And all the money that has been spent. If you get vaccines from 3 different sources and then only 1/10 of people get vaccinated, what happens to the remaining vaccines, the remaining 19? That's that would be a colossal waste of money. And so before we get to the level of vaccine, this is the time we need to begin to sensitize them.
All right, a lot of work for the government. We appreciate your time. Thank you so much, Professor Obilade, public health expert. Thank you for joining us on the program.
You're welcome.
We're learning that Russia's Sputnik V COVID-19 vaccine gives more protection against the disease than thought, up to 95%. Controversy over the speed with which the vaccine was produced, raising concerns over it being rolled out before the final trial date had been released, have most recently turned to praise. According to scientists now, the vaccine rolled in a similar way to the Oxford-AstraZeneca vaccine developed in the UK and the Janssen vaccine developed in Belgium. Well, here's more on that in our global COVID-19 update.
Late-stage trial results published in The Lancet reveal that Russia's Sputnik V coronavirus vaccine gives around 92% protection against COVID-19. It has also been deemed to be safe and offer complete protection against hospitalization and death. The vaccine was initially met with some controversy after being rolled out before the final trial data had been released. But scientists say its benefit has now been demonstrated. Meanwhile, the first batch of Russian Sputnik V vaccine arrived in Hungary less than a month after the country signed a deal with Moscow to buy the COVID-19 shots. The shipment contains 40,000 vials, enabling Hungary to inoculate 20,000 citizens. The vaccines would undergo tests at the National Public Health Center before the shots are distributed. Under a deal signed last month, Russia will ship 2 million doses of the vaccine to Hungary in the coming 3 months. Britain begins door-to-door COVID-19 testing of 80,000 people in a bid to stem the spread of the South African variant of coronavirus. Public Health England said it had identified a total of 105 cases of the South African variant since December 22, 2020. And to contain the new outbreaks, residents in 8 areas of the country will now be tested whether or not they are showing symptoms, a process known as surge testing.
This is the first day of a major operation to test 10,000 people in the Woking area for the South African variant of COVID. So we've planned over the weekends how we're going to do that in an area of Woking. We're bringing together each day around 100 volunteers and member of staff from a wide variety of organisations.
Japan has extended a state of emergency in Tokyo and other regions for another month, seeking to keep the upper hand over a COVID-19 outbreak, even as daily case numbers begin to edge down. Prime Minister Yoshihide Suga announced the measure despite daily numbers of COVID-19 beginning to fall. Suga, at the government's coronavirus task force meeting, said the emergency will be extended for 10 prefectures, including Osaka and Kyoto in western Japan, with the country facing its third and most lethal wave of the virus.
Continue to take responsibility, and for more updates on the coronavirus, the pandemic, you can take a look at our website. It's channelstv.com. You will find some stories there, the latest, plus other stories as well. Politics, business and sports at your fingertips. That's the program this evening. Thank you for watching. Stay healthy, stay safe. I'm Millicent Walker.